1. A nurse is caring for a patient who has been prescribed furosemide. The patient reports muscle weakness and cramping. Which nursing action is most appropriate? 1. Encourage fluid intake. 2. Notify the provider. 3. Administer calcium supplement. Answer: notify the provider. Rationale: muscle weakness and cramping may indicate hypokalemia, a known side effect of furosemide. The provider should be notified for further evaluation and potential potassium supplementation. 2. A patient is receiving vancomycin 4. The nurse notices red flushing of the face, neck, and upper chest. What is the nurse's priority action? 1. Stop the infusion. 2. Slow the infusion rate. 3. Notify the provider. Answer: slow the infusion rate. Rationale: the patient is likely experiencing red man syndrome, a reaction to rapid vancomycin infusion. Slowing the rate is the priority intervention before stopping the medication or notifying the provider. 3. A nurse is monitoring a patient who recently started captopril. The patient reports dizziness when standing. What is the most likely cause? 1. Orthostatic hypotension. 2. Hypertension. 3. Fluid overload. Answer: orthostatic hypotension. Rationale: ACE inhibitors like captopril can cause first-dose hypotension, especially upon standing, due to vasodilation. For a patient taking lithium reports increased thirst and frequent urination. What should the nurse do first? 1. Encourage hydration. 2. Hold the medication and notify the provider. 3. Document findings. Answer: hold the medication and notify the provider. Rationale: polyuria and polydipsia can be early signs of lithium toxicity. Lithium has a narrow therapeutic range, and toxicity can be life-threatening. 5. A nurse is caring for a patient who is receiving digoxin. Which finding requires immediate attention? 1. Heart rate of 58 BPM. 2. Potassium level of 3.1 milliequivalent/L. 3. Nausea and blurred vision. Answer: nausea and blurred vision. Rationale: these are signs of digoxin toxicity. Early recognition and intervention are critical to prevent serious complications, such as arrhythmias. 6. A patient is prescribed amiodarone. Which findings should the nurse report to the provider? 1. Cough and shortness of breath. 2. Mild bradycardia. 3. Occasional dizziness. Answer: cough and shortness of breath. Rationale: amiodarone can cause pulmonary toxicity, and respiratory symptoms must be evaluated promptly to prevent irreversible lung damage. 7. A nurse is reviewing the medications for a patient taking warfarin. Which of the following over-the-counter medications should the nurse advise the patient to avoid? 1. Acetaminophen. 2. Ibuprofen. 3. Loratadine. Answer: ibuprofen. Rationale: NSAIDs like ibuprofen can increase the risk of bleeding in patients taking warfarin due to their antiplatelet effects. 8. A patient prescribed metformin is scheduled for a CT scan with contrast. What should the nurse do? 1. Administer metformin as ordered. 2. Withhold metformin before the procedure. 3. Increase the dose after the scan. Answer: withhold metformin before the procedure. Rationale: iodinated contrast can increase the risk of lactic acidosis when combined with metformin. The medication should be held before and after the procedure. 9. A nurse is caring for a patient on clozapine. Which lab result is most concerning? 1. WBC of 3,000/mm superscript 3. 2. Platelet count of 150,000/mm superscript 3. 3. Hemoglobin of 13G/DL. Answer: WBC of 3,000/mm superscript 3. Rationale: clozapine can cause agranulocytosis. A low WBC count increases the risk of life-threatening infections. 10. A patient taking phenytoin presents with unsteady gait and slurred speech. What is the nurse's best response? 1. Administer the next dose. 2. Hold the medication and notify the provider. 3. Encourage ambulation. Answer: hold the medication and notify the provider. Rationale: these are signs of phenytoin toxicity, which can cause CNS depression and impaired coordination. 11. A nurse is preparing to administer insulin glargine. Which action is correct? 1. Mix with regular insulin. 2. Administer in the same syringe as NPH. 3. Give in a separate syringe without mixing. Answer: give in a separate syringe without mixing. Rationale: long-acting insulin like glargine should not be mixed with any other insulin due to altered pharmacodynamics. 12. A nurse is caring for a patient receiving haloperidol who develops muscle rigidity, fever, and altered mental status. What should the nurse suspect? 1. Serotonin syndrome. 2. Tardive dyskinesia. 3. Neuroleptic malignant syndrome. Answer: neuroleptic malignant syndrome. Rationale: NMS is a rare but life-threatening side effect of antipsychotics like haloperidol. It requires immediate discontinuation and emergency treatment. 13. A patient reports taking nitroglycerin at home, but still has chest pain after 3 doses. What is the nurse's next action? 1. Encourage rest. 2. Call emergency services. 3. Administer more nitroglycerin. Answer: call emergency services. Rationale: continued chest pain after 3 doses of nitroglycerin may indicate a myocardial infarction, requiring immediate emergency care. 14. A nurse is monitoring a patient receiving enoxaparin. Which finding requires immediate attention? 1. Mild bruising at injection site. 2. Black tarry stools. 3. Injection site redness. Answer: black tarry stools. Rationale: this suggests gastrointestinal bleeding, a serious adverse effect of anticoagulant therapy like enoxaparin. 15. A patient taking prednisone reports mood swings and increased appetite. What is the appropriate nursing response? 1. Reassure the patient that this is expected. 2. Notify the provider immediately. 3. Hold the medication. Answer: reassure the patient that this is expected. Rationale: corticosteroids like prednisone often cause mood changes and increased appetite as common side effects. 16. A nurse is assessing a patient taking albuterol. Which findings should be reported? 1. Increased heart rate. 2. Fine hand tremors. 3. Palpitations. Answer: palpitations. Rationale: palpitations can indicate cardiac stimulation and may be a sign of albuterol overuse or sensitivity, requiring evaluation. 17. A patient receiving gentamicin has a rising creatinine level. What should the nurse do? 1. Continue the medication. 2. Increase fluid intake. 3. Hold the drug and notify the provider. Answer: hold the drug and notify the provider. Rationale: gentamicin is nephrotoxic. An elevated creatinine indicates possible kidney damage, and the drug should be held. 18. A patient taking rifampin for tuberculosis reports orange-colored urine. What should the nurse do? 1. Stop the medication. 2. Reassure the patient this is an expected effect. 3. Notify the provider. Answer: reassure the patient this is an expected effect. Rationale: rifampin commonly causes orange discoloration of body fluids. It is harmless and expected. 19. A nurse is educating a patient on simvastatin. Which instruction is most important to include? 1. Take the drug in the morning. 2. Report muscle pain immediately. 3. Avoid all dairy products. Answer: report muscle pain immediately. Rationale: muscle pain may indicate rhabdomyolysis, a serious side effect of statins. Early detection is crucial. 20. A nurse delegates the administration of a topical nitroglycerin patch to a licensed practical nurse LPN. What must the RN ensure before delegation? 1. That the LPN understands to rotate sites. 2. That the LPN documents administration. 3. That the LPN checks blood pressure before application. Answer: that the LPN checks blood pressure before application. Rationale: nitroglycerin can cause hypotension. It is essential to assess blood pressure prior to application to prevent complications. 21. A nurse is monitoring a patient who is receiving morphine by a PCA pump, which finding requires immediate intervention. 1. Constipation. 2. Sedation and a respiratory rate of 8 per minute. 3. Nausea. Answer: sedation and a respiratory rate of 8 per minute. Rationale: respiratory depression is a life-threatening side effect of opioids like morphine. A respiratory rate under 10 requires immediate intervention. 22. A patient taking spironolactone presents with muscle weakness and ECG changes. What should the nurse suspect? 1. Hypernatremia. 2. Hyperkalemia. 3. Hypocalcemia. Answer: hyperkalemia. Rationale: spironolactone is a potassium-sparing diuretic and can lead to elevated potassium levels, which affect cardiac and muscular function. 23. A nurse is teaching a patient prescribed levothyroxine. Which statement indicates a need for further teaching? 1. I will take this with a full glass of water. 2. I'll take it before breakfast. 3. I can stop it once I feel better. Answer: I can stop it once I feel better. Rationale: levothyroxine is a lifelong therapy for hypothyroidism. Stopping the medication can cause severe hypothyroid symptoms. 24. A patient taking methotrexate for rheumatoid arthritis reports mouth sores and fatigue. What is the most appropriate nursing action? 1. Reassure that this is expected. 2. Assess for bone marrow suppression. 3. Encourage fluid intake. Answer: assess for bone marrow suppression. Rationale: methotrexate can cause myelosuppression, leading to infections, anemia, and oral ulcers. These symptoms warrant further evaluation. 25. A patient receiving heparin therapy has an APTT of 120 seconds. What is the nurse's best action? 1. Administer the next dose. 2. Notify the provider and prepare antidote. 3. Document and continue monitoring. Answer: notify the provider and prepare antidote. Rationale: an APTT of 120 seconds is critically elevated and increases bleeding risk. The provider must be notified and protamine sulfate prepared. 26. A nurse is caring for a patient on sertraline who reports increased restlessness and confusion. What should the nurse do first? 1. Assess for serotonin syndrome. 2. Hold the next dose and document. 3. Reassure the patient. Answer: assess for serotonin syndrome. Rationale: restlessness and confusion may be early signs of serotonin syndrome, a potentially life-threatening condition. 27. A patient taking isoniazid complains of numbness and tingling in their hands. What is the most appropriate intervention? 1. Assess for hypocalcemia. 2. Notify the provider and suggest vitamin B6. 3. Hold the medication. Answer: notify the provider and suggest vitamin B6. Rationale: isoniazid can cause peripheral neuropathy due to B6 deficiency. Supplementation with pyridoxine B6 is recommended. 28. A nurse is preparing to administer potassium chloride 4. What must the nurse do before starting the infusion? 1. Administer it as 4 push. 2. Confirm the patient has adequate urine output. 3. Shake the solution before giving. Answer: confirm the patient has adequate urine output. Rationale: potassium should not be given if urine output is low, as impaired excretion increases risk for life-threatening hyperkalemia. 29. A patient receiving chemotherapy reports mouth pain and white patches in the oral cavity. What is the nurse's priority intervention? 1. Offer ice chips. 2. Assess for oral thrush. 3. Provide salt water rinse. Answer: assess for oral thrush. Rationale: chemotherapy suppresses immunity and predisposes to opportunistic infections like candidiasis. Assessment guides treatment. 30. A patient on metoprolol develops a heart rate of 50 bpm. What is the best nursing action? 1. Administer the dose and monitor. 2. Hold the dose and notify the provider. 3. Give atropine. Answer: hold the dose and notify the provider. Rationale: beta blockers can cause bradycardia. The nurse must hold the medication and inform the provider for further instructions. 31. A nurse is educating a patient starting allopurinol. Which patient statement requires correction? 1. I will drink plenty of fluids. 2. I can take this during an acute gout attack. 3. I should report any rash to my provider. Answer: I can take this during an acute gout attack. Rationale: allopurinol is used for prevention, not treatment, of acute gout. Starting it during a flare may worsen symptoms. 32. A patient is prescribed atorvastatin. Which lab value must be monitored closely? 1. BUN. 2. Creatine kinase. 3. Platelet count. Answer: creatine kinase. Rationale: elevated CK can indicate rhabdomyolysis, a serious adverse effect of statins, requiring immediate discontinuation of the drug. 33. A nurse is caring for a patient taking hydralazine. Which finding is a side effect that requires further monitoring? 1. Decreased heart rate. 2. Joint pain and fever. 3. Bradycardia. Answer: joint pain and fever. Rationale: these may indicate drug-induced lupus, a rare but serious complication of hydralazine. Further evaluation is needed. 34. A patient on fluoxetine reports new onset of suicidal thoughts. What is the nurse's immediate priority? 1. Contact the provider. 2. Document findings. 3. Increase antidepressant dose. Answer: contact the provider. Rationale: SSRIs like fluoxetine may initially increase suicidal ideation. Immediate provider notification is necessary to ensure safety. 35. A nurse is preparing to administer phenytoin. What precaution must the nurse take? 1. Mix with dextrose 5%. 2. Administer rapidly. 3. Use normal saline only. Answer: use normal saline only. Rationale: phenytoin must be diluted in normal saline due to compatibility. Mixing with dextrose causes precipitation and is unsafe. 36. A patient taking carbamazepine reports fever and sore throat. What is the nurse's priority action? 1. Suggest lozenges. 2. Assess white blood cell count. 3. Withhold fluid intake. Answer: assess white blood cell count. Rationale: carbamazepine can cause agranulocytosis. A fever and sore throat may signal infection due to low WBC count. 37. A nurse is caring for a patient on sildenafil. Which medication should the nurse ensure the patient avoids? 1. Lisinopril. 2. Nitroglycerin. 3. Metformin. Answer: nitroglycerin. Rationale: the combination of sildenafil and nitrates can cause severe hypotension, leading to life-threatening cardiovascular collapse. 38. A patient on levodopa-carbidopa reports new involuntary movements. What should the nurse do? 1. Hold the medication and notify the provider. 2. Continue medication as prescribed. 3. Reassure the patient. Answer: hold the medication and notify the provider. Rationale: dyskinesias can occur with levodopa toxicity and must be reported. Dosage adjustment may be necessary. 39. A nurse is caring for a patient on cyclosporin after kidney transplant. Which side effect should the nurse monitor closely? 1. Hypoglycemia. 2. Hypertension. 3. Depression. Answer: hypertension. Rationale: cyclosporin is an immunosuppressant that can cause nephrotoxicity and hypertension. Regular monitoring is necessary. 40. A nurse is educating a patient starting bupropion for smoking cessation. Which symptoms should be reported immediately? 1. Dry mouth. 2. Insomnia. 3. Seizures. Answer: seizures. Rationale: bupropion lowers the seizure threshold. Any seizure activity requires immediate discontinuation and medical evaluation. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!